Hello, everyone. Welcome. My name is Terrell Parker, and I'm an associate manager here at IMAX Center to End Epidemics. Welcome to today's Escalate informational webinar. Next slide. Objectives. Escalate project, an overview of our technical assistance track and our learning collaborative track as well, and how your organization can hopefully get involved with Escalate. Next slide. Welcome. We'll start with the quick disclaimer. Escalate is supported by the Health Resources and Services Administration, HRSA of the U.S. Department of Health and Human Services, and the Minority HIV/AIDS Fund. As a part, this is 100% funded by HRSA HHS, and the contents of this presentation are those of the authors and do not necessarily represent the official views, nor an endorsement by HRSA or the U.S. government. Next slide. So, what is Escalate? Probably what you all are wondering today. Escalate stands for Ending Stigma Through Collaboration and Lifting All to Empowerment. But what does that mean? The project focuses on training and building the capacity of the Escalate participants to recognize, one, and secondly, address HIV-related stigma within Ryan White HIV/AIDS program. Next slide. So what is the purpose of Escalate? One, the purpose of Escalate is to reduce stigma for people with HIV on multiple levels throughout the healthcare service delivery system. We know what this looks like in our community. We often hear that HIV-related stigma impacts individuals' ability to seek care, where they seek care, and also their ability to sustainably engage in care. So we hope that Escalate will reduce that HIV-related stigma that people with HIV often face within our care systems. And the program also focuses on implementing various stigma-reducing approaches with an emphasis on increasing cultural humility in care and treatment settings for people living with HIV. We know how important cultural humility and cultural competence is for the work that we do. And we hope that all of our participants in Escalate will gain the skills and the tools that they need to help increase cultural humility and cultural competence in the services that they provide. Next slide. So one thing that we want to highlight that is extremely important for us is the level of community involvement that we've had throughout the Escalate project. Over the last year, Escalate, the NMAC team and our community partners, along with community members, have worked diligently to create our Escalate curriculum and our Escalate tracks. The central focus of Escalate is community involvement, as we mentioned earlier, to increase cultural competency. We know that HIV-related stigma is multidimensional, that it's complex, and it affects people within the intersections of those living within nuances. So if we wanted to build a program or a project that really spoke to the needs of those diverse communities, we felt like it was important to involve the affected communities in this project from the beginning. We have engaged over 60 subject matter experts from impacted community on every aspect of the project. That includes the design of our curriculum, that includes our evaluation, that includes everything to our communications that we send. We really know that community input is important if we're going to do this work to end HIV-related stigma within our care systems. Next slide. So who will Escalate engage? This is one of the questions that we get most commonly. Is Escalate for me? Well, I hope the answer to that question today is yes. Escalate will specifically engage Ryan White HIV/AIDS providers, programs, recipients, and subrecipients. So that's important to note. That can be organizations, community-based organizations, federally qualified health centers, health departments, planning councils, and planning bodies. If you're a recipient or a subrecipient of Ryan White, Part A, B, C, or D, then Escalate is for you. Next slide. Specifically, as we mentioned earlier, it's important for Escalate to center on the communities that are most impacted by HIV-related stigma and the intersecting stigmas as well. So for our approach in reducing HIV-related stigma, we felt like it was important to also highlight certain communities. Those communities include, but are not exclusive to, transgender and gender nonconforming individuals, men who have sex with men, Black and African American communities, Latinx communities, and American Indian, Alaska Native communities. So as we mentioned earlier, it was important for us to bring community members and representatives of these communities to the table as we design this project. Next slide. As we continue to do our work to end the HIV epidemic by 2030, which is our goal, we hope to accomplish that. We hope to reduce new HIV acquisitions by 90% by 2030. And if we're going to do that, we know that we must do work to reduce HIV-related stigma in our care services. Time and time again, we hear anecdotal stories from our clients, from our patients of the HIV-related stigma that they face. So NMAC and our partners believe that if we're going to end the HIV epidemic in the United States, we must be serious about reducing and eliminating HIV-related stigma within our systems. Next slide. Of course, Escalate would not be where it is today without our amazing partners. We have some of our partners here today who are going to share with you information on technical assistance and learning collaboratives, but I'd like to thank and highlight our partners at Apton Associates, NORC at the University of Chicago, and TRX Development Solutions. Next slide. The Escalate model. As we mentioned, Escalate is a 3-track program, and we hope that somewhere within those 3 tracks, you will find a place for your organization. Unfortunately, our first round of applications for training has closed, but there will be opportunities later this year and next year for you to apply for our new and innovative stigma reduction training. Today, our partners at Apton Associates will tell you more about how you can engage with our targeted, time-limited technical assistance, and our partners at NORC at the University of Chicago will tell you how you can engage with our amazing learning collaboratives. Next slide. First up, I'd like to welcome Nikki from Apton Associates, who will tell you more about how you can get engaged with technical assistance. Nikki?
Hi, thanks, Terrell. Hi, everyone. My name is Nikki Reddy. As Terrell mentioned, our team manages the technical assistance for this project. Next slide, please. So this is our wonderful TA team at APT. I just wanted to give a quick shout out to our team and thank them for all of their behind the scenes work in getting our TA track ready to launch. Some of our team members are on the call today and will be able to take your questions in the chat and answer them throughout this webinar. Next slide, please. Great, so technical assistance, what is TA? That is the question. TA is designed to be a time-limited tailored program that's specific to each organization that applies. It's for organizations that have the capacity to tackle HIV-related stigma, organizations that have a specific challenge that they're dealing with, and organizations that are looking for specific tailored one-on-one coaching and approaches for addressing stigma. So we're creating organizational level change through targeted work plans. And these work plans are going to be very customized to the individual experience of your organization. We are also going to be offering TA in 2 forms. So there's organization-specific work and then cohort level. So in the cohort level, you'll get to know some organizations that are dealing with similar challenges and hopefully have some best practice and knowledge sharing with other participants to help try and solve these challenges. Next slide, please. What will you get out of Escalate TA? So first, you will get individualized coaching. So that means that you'll be matched with a TA coach from our team and then matched with a pool of subject matter experts with lived experience and a history of working in the field to overcome individual level hurdles. So if you're dealing with something that's very specific to your organization or local community, we can help brainstorm best ways to overcome those challenges. You'll also get opportunities to participate in co-learning. So that's learning alongside other organizations that may be experiencing similar challenges. And then SMEs can help connect you to additional colleagues in the field who may be in a similar situation and have created new policies, procedures, organizational structures that have helped them address HIV related stigma in their local settings. We want to make sure that participants walk away with tools, so not just high level thinking of how could you potentially overcome a challenge, but what are the actual strategies that you can put into practice during the TA and then after TA so that this truly becomes a sustainable practice for your organization. We also want to make sure that there's reduced time from innovation to practice. Um, so reducing the time from thinking about challenges, conceptualizing your game plan, to putting them into practice and getting those measurable results for your community. We also want to address gaps in practice and translate evidence to practice. And we also want to make sure that we're using the evidence base that's already been established and making sure that you can implement these solutions in your local communities. Next slide, please. Great. So what will you have access to? So if it sounds like TA might be a good fit for your organization, that's great. That's wonderful. You're probably wondering, what is TA actually going to involve? So like I mentioned, you're going to get matched with a trained TA coach. So that's going to be your point person. So that's someone that you will be able to have monthly check-ins with. They'll also help create a customized work plan for your organization. So using your application and an organizational self-assessment, we'll create this customized work plan that will link SMART objectives. So we'll be able to see, where do you want to be at the end of this 9-month TA engagement? And then we'll be able to create a plan to get you there and measure your progress along the way. So beyond the organizational assessment, TA work plan, and the monthly one-on-one check-ins, you'll also get individualized organization trainings. So for instance, if your organization needs to get a group of people together to solve a problem, we can help facilitate those conversations and make sure that they're in service to your work plan and achieving those objectives. We'll also have ad hoc opportunities. So as things come up, we're available to have additional calls, subject matter expert calls, office hours, really to make sure that you get the responses you need to help solve the specific challenge that you're working towards solving. Once you have completed TA, you might be thinking that you're ready to do more and take on more within your organization, which is amazing. And there's going to be the potential opportunity to join the Escalate Learning Collaboratives upon completion. And our colleagues at NORC are going to tell us a little bit more about learning collaboratives later on in this webinar. And just to know, it's not on this slide, but I just want to make sure I mention that if you participate in any one of these 3 tracks, being training, technical assistance, or learning collaboratives, there are ways to participate in the other activities throughout the time period that Escalate is running. So just really wanting to emphasize that there's no wrong door to getting involved in Escalate. Next slide, please. Eligibility and requirements. So the eligibility and requirements are very similar across the 3 tracks, and Terrell opened this webinar mentioning them, but they're here again on the slide. So we are looking for Ryan White funded recipients and subrecipients. So that's parts A, B, C, or D. You don't need to have all of the parts at your organization in order to participate in Escalate. And specific to TA, we are looking for stigma reduction teams of 3 to 5 members from your organization. We're going to ask for a demonstrated organizational commitment to address specific HIV stigma within your organization and community. And then we're also going to ask for your organizations and your stigma reduction team members' availability to participate in TA sessions. Our TA runs in a 9-month cohort, and we're going to ask for about 3 to 5 hours from your organization per month to engage in TA activities. Next slide, please. So here is our current timeline. The TA application is open through September 3rd. After it closes, we're going to be making decisions in partnership with our colleagues at HRSA around applications. And this will be happening in September and October. And then we expect to notify applicants of decisions in October and November. And shortly thereafter, TA coaches will begin outreach to selected participants. And that's the process, that's the timeline for cohort 1, sorry. And then we will be repeating this process for cohort 2 starting in March 2022. Next slide, please. And this is my contact information. My phone number, my email address are on this slide, so please feel free to contact me directly if you have any questions about applying for TA. Chip, I don't know if we want to take questions now or at the end of the webinar.
We can hold until the end.
Okay, perfect. That sounds great. So I think next on deck, we have Shannon from NORC. She'll be talking about learning collaboratives.
Awesome. Thanks so much, Nikki. And while everything that Nikki just told you about TA is fresh in your mind, I want to just quickly, before getting into the nuts and bolts of the learning collaborative, explain the key difference in eligibility requirements between the Escalate TA and LCs. And that it's largely the same, so it's going to look very similar when you're looking at the applications and the questions. But the primary difference is the stage that you're at with your organization, where TA is more focused on identifying the needs of the community and building a plan of action. The LCs is really geared more towards those who are either right at the point of beginning to implement a stigma reduction initiative or already in the throes of that work and really looking for some peer-to-peer support in that process. So with that said, that's an important point. I just want to state that right at the top, and then let's get going. So next slide, please. Here is NORC's team working on this Escalate project. I will save your time by not reading everything off the slide. I will note I got a haircut recently, so you can observe that from this slide. So we have a great team of folks. Some of these are going to be working as LC liaisons, which is very similar to a TA coach, or that like primary point of contact with our team. Next slide, please. Okay, so let's start with the basics. What is a learning collaborative? So an LC is an initiative in which organizations come together to study and apply quality improvement methods to a focused topic area. So organizations typically work together for a year or longer, participating in learning sessions led by subject matter and quality improvement experts, and actively engage in action periods between learning sessions to implement those practices and strategies they talk about and learn about during those group sessions or meetings. So through co-learning and knowledge creation, the collaborative can address gaps in practice or the translation of evidence to practice and achieve common goals or common performance metrics across organizations. Next slide, please. So specifically, the Learning Collaborative for Escalate will focus on supporting and testing the implementation of an HIV stigma reduction initiative at your organization that is aimed at reducing the impact of HIV stigma. And it's important to note that this also includes other types of stigma or discrimination that can exacerbate the experience of HIV stigma for individuals on a population that your organization serves. So these other types refer to things like racism, transphobia, homophobia, stigma about formerly incarcerated individuals, lots of other types that we'll talk about once we get into the LC and think about the needs of the community you're serving. So each LC will bring together organizations that are ready to implement or already implementing stigma reduction initiatives, as I mentioned, for coaching, peer-to-peer learning, collaborative tracking of progress toward your intended outcomes, and support from stigma reduction subject matter experts. Next slide, please. So the Escalate LCs will be run in 2 cohorts. The first will start this fall in October and run for about 14 months with a maximum of 8 organizations getting selected to participate. And the exact timing is TBD on the next one, but the second cohort will start in the winter of 2023, also running for about 14 months. And that one will be up to 16 organizations that get selected to participate. The first one will focus on cultural humility, and the topic of the second one will be determined based on the interests and needs of those who apply at that time. Next slide. So what are the benefits of participating in the Escalate LC? First is support for implementing the strategies to address the HIV stigma within your organization, opportunities to learn from experts as well as other organizations who are implementing stigma reduction initiatives, especially those that are focused on the same populations and types of stigma that your organization is addressing, as well as coaching to overcome hurdles. This is the LC liaison. That'll be that one-on-one point of contact I mentioned. So co-learning, knowledge creation, and support from like-minded organizations as well as experts is the key there. Next slide, please. So you will also get tools to evaluate your progress and assess improvements. These are Plan, Do, Study, Act, or PDSA cycles, and that'll help you track the overarching goals of your stigma reduction initiative, the activities that you're implementing to achieve those goals, and be able to track your progress over time over the 14 months that we'd be working together. And ultimately, this leads to stronger, more effective, more responsive stigma reduction initiatives, reduced time from innovation to practice, and the ability to address gaps in practice, translation evidence to practice, and achieve those common goals or metrics that we talked about. Next slide. All right, so what will be required of learning collaborative members? So each organization participating in the LC will need to identify a primary point of contact, who we refer to as the stigma reduction change agent. In addition to this individual, each organization will need to identify 3 to 5 members of their organization who will form a stigma reduction team. And the entire team will be actively engaged in this work over the 14-month period. We require that at least one person on your stigma reduction team represents members of the population on which your stigma reduction activity focuses, as well as people representing a wide range of roles and seniority within your organization. While it's not a requirement, we strongly recommend that your stigma reduction team also includes client-facing staff, such as frontline staff, patient educators or navigators or providers. Next slide, please. What will be required of learning collaborative members, part 2. So each LC will be convened over a 14-month period, as I've mentioned, during which we estimate that team members will need to devote approximately 6 to 10 hours per month, and that will ebb and flow based on what we're doing in a given month. It's important to note that this is in addition to the work that you're doing regularly to implement your stigma reduction initiative, which of course will vary based on what you're seeking to achieve. So successful participation in the Learning Collaborative requires engagement in live and virtual meetings. So the most important of which is the learning sessions. So every 3 to 4 months, we will facilitate a learning session, which is about 4.5 hours long. It's a virtual interactive meeting with all LC member organizations and the NORC team. And it includes learn, share, and compare components that allow you to learn from other organizations in the collaborative and from SMEs or subject matter experts with academic, professional, as well as lived experience. Share about your organization's stigma reduction initiative progress, the challenges that you're facing, how you're overcoming those challenges, getting feedback from others about how they've addressed those challenges, as well as the successes. And then compare allows you to benchmark your organization's progress against other organizations in the LC as a whole by reporting those common metrics. And then between the learning sessions that occur every 3 to 4 months are what we call action periods. And that's where you have an opportunity to implement your stigma reduction initiative that you've planned or already begun, meet regularly to ensure progress in implementing the initiative, discuss challenges and solutions with your team as well as with your LC liaison or coach. You can also attend affinity group webinars. So we plan to match LC member organizations with other organizations who are working to address HIV stigma in similar populations, or they're addressing the same type of issue. So we put them in what we call affinity groups, and we're going to be hosting webinars. Either we are, or we're bringing in subject matter experts to host webinars on topics of interest for those particular affinity groups. So those webinars will be going on during the action period. You will also be sending out a Learning Collaborative newsletter to keep you updated on all things Escalate LCs, and the quality improvement tracking and evaluation, that PDSA worksheet that I talked about, to help keep you on top of your initiative and your progress. Next slide, please. All right, so what's next? Most importantly, what's next is it is the application period right now. So as Nikki mentioned, the applications are open until September 3rd. I strongly recommend that if you have any questions or interest, if you think this sounds right up your alley, please reach out to us if you have any questions. You can go to targethiv.org/escalate, and there you can click on the Learning Collaboratives or the TA tab. It's a joint application, so either way, you'll get to the right place. You can see some high-level overview of the TA or the LC, and then there's a large blue button, Apply for an Escalate Learning Collaborative. Click on that. That will take you to the web-based application. However, before filling it out online, we strongly recommend that you print out the PDF, which is the blue button right below the application itself. Get with your stigma reduction team, talk through those questions together. I promise you, everything we ask is important. We really want to know what your needs are, what your starting point is, like what you're struggling with, where you're crushing it. We want to know all the things. So if you have any questions about how to fill it out or what kind of information we're looking for, please don't hesitate to get in touch with us and we can help you get that filled out successfully. So after applications close, we'll be reviewing the applications and notifying applicants of our decisions in mid to late October, and then we get started. So once those LC member organizations have been notified that they've been selected to participate, we'll send out some information, including a LC member packet, and we'll point you to some of the things that you need to do in advance, just a little pre-work, a baseline evaluation, and looking at that PDSA form that I talked about to lay out what your goals and objectives are. And then the first design meeting is in November. We'll gauge people's availability and then get that on the books. But the design meeting is really important. It's an opportunity for us to come together, not only introduce ourselves and start getting to know each other and the initiatives that you're implementing, but also an opportunity to ratify those common metrics that I keep referring to that we're going to be tracking along the course of the 14-month LC, and also to establish an LC charter. So this is not just what's required and what you're going to be doing, the logistics of the LC, but this is also an opportunity to vocalize how we want to work together, how we're going to create a safe space for one another, how we're going to listen to each other, what's the best way to communicate and really make this as effective as possible. So that's going to be a really important meeting. And then from there, we start with our first learning session towards the end of November or beginning of December. Next slide. So that is it. Again, I'm Shannon Tenbrook. I'm a Senior Research Director at NORC, and I welcome you again. If you have any questions about LCs or about the application process, you can get in touch with everybody on our team using escalate@norc.org, and we will get back to you and answer any questions you may have. So with that, thank you so much for joining, and I'll pass it back to Terrell.
Thank you, Shannon. And now we will open the floor for question and answer. Thank you, Shannon and Nikki, for such a thorough overview of how folks can get involved with the Technical Assistance and Learning Collaboratives. And as they mentioned, September 3rd, the deadline is quickly approaching, so be sure to go to targethiv.org to submit your Escalate application. And if you have any questions, please submit them into the chat box. Do we have any questions?
Yeah.
We were just so thorough, Terrell.
I know we're just so thorough. All right, we'll leave it open for a little while longer to see if anyone has any burning desires, any questions that you'd like to ask. And if not, we included our contact information so you can always follow up with us afterwards. All right, next slide, Chip. Feel free to get in touch with us at NMAC as well if you have any questions or if you have any last minute questions, or you just want to go ahead and submit your application. Feel free to get in contact with us. You can reach us at escalate@nmac.org. And thank you for joining today's webinar. We look forward to receiving your application. As we mentioned, stay tuned in the coming weeks on targethiv.org. We will also be releasing training dates for our next round of Escalate training as well. So there's more to come from Escalate.
Thanks, everybody.
Thank you.
Thanks. Good afternoon. All right, Chip. No questions today.